Healthcare PPPs get compared to toll roads and rail concessions all the time. They shouldn't be. A hospital deal has to solve for things a road never touches, and getting one of those wrong is what turned a country's flagship hospital PPP into a fiscal crisis. First, demand risk works completely differently here. Nobody chooses to get sick the way they choose to take a toll road. Patient volume is driven by population health and referral policy, not user choice, which is why almost every healthcare PPP is structured as an availability payment, not a user pays concession. Second, the payment mechanism has to measure clinical quality, not just whether the building is open. Infection rates, wait times, patient outcomes, deductions get tied to actual care quality, a far more complex service specification than is the road drivable. Third, medical technology and clinical standards move faster than almost anything else you'd put into a 30-year contract. A well-drafted healthcare PPP needs a built-in refresh mechanism for equipment and protocols. A toll road doesn't need to plan for a new generation of asphalt every 5 years. Fourth, and the one that actually breaks deals, health budgets grow under constant political pressure. Aging populations, shifting disease burden. A PPP locks in a fixed payment obligation for 15 to 30 years regardless. Lesotho's 2011 hospital deal shows exactly how that plays out. An 18-year contract with Netcare's Tsepang consortium delivered genuinely better clinical care, more patients treated, real outcome improvements. But running costs grew to $67 million a year, 51% of Lesotho's entire health budget, roughly 3 times what the old hospital cost. That's not a construction failure or a broken promise. The contract delivered exactly what it was designed to deliver. It's consideration for playing out in real numbers, clinically sound and fiscally unsustainable at the same time, because affordability was never stress-tested against the budget's actual growth path. 4 things that make healthcare PPPs different: demand risk tied to policy, not choice; clinical KPIs in the payment mechanism; technology refresh built in; and fiscal affordability tested against a budget that has to keep growing. That's PPP Case Studies. Healthcare, subscribe to follow the series.